Subscribe to our channel now and press the bell icon to never miss an update from KIMS Global.
Hi, I'm Dr. Vidyalekshmi. I work as a senior consultant in the Department of High Risk Pregnancy and Fetal Medicine at KIMS Hospital, Trivandrum. Even when a woman is low risk, she needs to go through a battery of tests, which is definitely needed because we miss certain things if you don't go through that. What the protocol says anywhere in the world, what I'm going to follow is the protocol developed in the developed world is. Any woman who comes to her booking visit is the first visit which she makes with the doctor, her obstetrician or her general practitioner or a treating nurse. The booking visit will take a blood test called the first antenatal booking bloods, which includes her blood sugars, her thyroid status, the virology. Virology includes her hepatitis C, hepatitis B, her HIV status and syphilitic status. These are to be told to the patient before you take, and then she can opt in and opt out for an HIV screening, but it is usually told to the patient before she takes. And then we look at her hemoglobin status, whether she's anemic or not, and check her routine urine for her, any infection present or not. So these are the mandatory tests which we do in the first booking visit. If this woman is having a high risk chance for being diabetic, like any woman of Asian origin, I already told that she has a high risk. If one of the parents are having diabetes or both parents having diabetes, if a sister has diabetes or if the sister is having diabetes or there is a baby with higher weight for herself in the previous pregnancy, the booking visit itself we do a test called glucose tolerance test, where the patient should be undergoing a test called glucose tolerance test. If she is not in the high risk category, she doesn't have a risk for diabetes, the test is postponed to 26 weeks time frame, 24 to 26 weeks, which is called a glucose challenge test, not glucose tolerance test. The patient gets a glucose challenge test around 24 weeks time frame. If the first trimester booking bloods are normal, then she is brought back to the unit by around 24 to 26 weeks for a repeat of hemoglobin and looking back for the glucose test again. And we repeat the same sort of test towards delivery. If the mother is having a blood group which is negative and she is married to a man who is an Rh positive or a blood group positive, we look at a specific called ICT. That's a specific test called indirect KIMS test, which is very important, which will tell upon whether this woman has a risk of having a baby affected or not, because the father is Rh positive and the mother is Rh negative. If she turns out to be negative for ICT, we give them a shot of injection called anti-D at 28 to 32 weeks injection, and then look at the baby when the baby is born. If the baby is Rh positive, the mother gets an anti-D shot again after birth. This injection is a beautiful thing which has reduced the risk of babies becoming anemic during pregnancy and after birth, because it reduces the risk of anemia due to the blood group incompatibility between the husband and the wife. Even in a low risk pregnant woman, previously we thought certain scans are mandatory only for a woman above the age of 35. That is above 35 who is classified as advanced maternal age. But now we know that because lots of works have been happening everywhere in the world, that the screening for chromosomal problems or genetic disorders should happen for every woman. Now it is considered as a universal screening modality. It is not a selective screening anymore. Most of the time we get patients who are selectively screened and they miss the screening. And why? Because the risk of having a chromosomal problems or Down syndrome is not unique to any age. It can happen to any woman, but believe the age increases the risk. But even young age is not a bar to have a baby with a chromosomal problem. So the screening is now universal. So any woman is pregnant, she is offered the screening between 12 and 14 weeks of pregnancy. That's called the combined first trimester screening modality for screening for chromosomal defects. This involves a specialized scan called a nuchal scan, and along with that a particular blood test should be taken, and the risk is assessed together. It is not separate. It is not by the nuchal alone or the bloods alone, because these are the misconceptions. Most of the time patients can come with just blood tests and just scan and say I'm normal, abnormal. No. There is classification or strategization can happen only with the combined test. So you need to go through the scan and then the blood test, and a good software should incorporate both to see whether the woman qualifies to be in the high risk group or a low risk group. So a number is given like 1 in 250 to say whether she's high risk or low risk. If she qualifies to be in the low risk, she is reassured saying that yes, your risk is much low to have a baby with chromosomal problems, but it is not zero because it's only a screening test. But this test should be offered to everybody. And coming to the second trimester, that 18 to 20 weeks time frame, every woman who is pregnant should have an anomaly scan done before 20 weeks of pregnancy. Before 20, I address specifically why? Because the time frame to act upon any test is 20 weeks in India. So, unless you have your second trimester screen or your blood test for second trimester and your anomaly scans before 20 weeks, you can't do anything about it. So, get your anomaly scan at 18 weeks of pregnancy, and along with that, you might have to do a blood test called quadruple screening test, which is the newer version of the old triple test, which is now not used much because the sensitivity of the quadruple screening test is much higher than the conventional triple test, which is done for those women who have missed their first trimester screen. So a combined screening at the second trimester at 18 to 20 weeks is also beautiful because you have enough and more opportunity to find out the baby is well or not.